I told them that my cycles were heavy and they put me on birth control.
They put me on birth control pills.
They put me on birth control pills.
I think that people have to take away from this that a pap smear is not going to tell you anything about your fibroids. A speculum exam is placing a speculum into the vagina to look around and to see the cervix and the inside of the vagina. If a fibroid is protruding, maybe you would see a protrusion into the vagina, but a pap smear is actually taking cells from the cervix to look for cervical cancer. So just because you have a pap smear doesn't mean someone is looking for a fibroid in and of itself. Fibroids typically can be palpated if they're large enough or felt on exam, on a digital exam and an abdominal exam. But something that is a gold standard for diagnosing fibroids that we don't do enough of, even though most of us have an ultrasound machine in our office, is a transvaginal or an abdominal ultrasound. Because it's a tumor, it can be seen on ultrasound, which is a minimally invasive diagnostic tool that I think we underutilize, especially in women of color who are disproportionately burdened by fibroids.
That's the beauty of fibroids too, is that you can see them, right? So some of the other things that we've talked about, adenomyosis sometimes can be missed and very difficult to actually see on imaging. Polyps are not always forthcoming. If you can have PCOS without having actual polycystic ovaries on the imaging, but fibroids, I mean, ultrasound is a very high yield and a very cheap testing modality. And patients and women, and when I talk to people that are on their journey, they just can't understand, why didn't they just simply order an ultrasound from me? I told them that my cycles were heavy and they put me on birth control.
They put me on birth control pills.
They put me on birth control pills. Did they get an ultrasound? Did they work it up? There has to be a change in this mentality that we can treat without understanding the underlying cause of our ailments. You want your doctor to be able to answer, and we don't always know. Sometimes the answer is, I don't know, but let's work this up. Let's figure it out.